With no further ado, I would like to introduce to you and ask you to welcome Supervisor Michael Antonovich.
Happy birthday. That was a very nice performance by the employees, and you did extremely well, and next year Marv is going to be involved. Anyway, happy birthday. On behalf of the county, we want to wish you continued success in your efforts during these very difficult times in which we're all undergoing at this time, not knowing what the end result is going to be, but hopefully we'll be able to work together to be able to maintain the opportunity of serving those who are in need with the resources that we have, and by developing aggressive public-private partnerships to continue those efforts. One of the programs that we were able to initiate back in 2006 in September was the Institution for Mental Illness Disease Beds, IMD. And with that, we were able to provide additional service for involuntary psychiatric treatment, intensive mental health, and supportive services and housing. And the reason I say that is because those of you who work in the downtown area and you travel Grand Avenue, you'll notice throughout the time that you travel in the daytime that there's a lady who sits on the corner of 1st and Grand in front of the courthouse. And she's there with her few packages, suitcases, whatever. And she's there every day. And we've set out with that team time after time after time. And regardless of the type of weather there is, she has refused to take advantage of those types of services. She's definitely need mental health treatment. There's another gentleman who usually sits on the other corner in front of lot 22, that little bus bench, which is operated by Dash on the corner of Temple and Grand. And he, again, regardless of the type of weather that we have, refuses, he's a veteran, refuses shelter and services that we send out to assist. If you go down to Central Jail, underneath the overpass, you'll have a couple of people that are there as well. Again, regardless of the type of temperature and time of year, we send out the PET team there. And anybody here from the PET team? Anyway, okay, there you go, right? You know what I'm talking about. And everybody knows everybody, and yet they refuse that help. We have a very serious problem. Drug abuse, alcohol abuse, mental illness. Unless we can get these individuals into treatment, they continue to be on that street corner, being subjected to the elements, many times becoming a victim of crime. And you remember the young lady from Pasadena who was stomped to death in a downtown porta potty about a year or so ago, from Pasadena area. Family, they had housing. She was in the housing. They had health insurance for her mental health. But because of her mental health condition, she came downtown about 2:30 in the morning and was a victim of crime. So what we need to have is to strengthen the laws that we have. And former Assemblywoman Helen Thompson, who is now a supervisor in Northern California, was involved in an effort to try to extend involuntary treatment to help these individuals. And we were able to help her with the legislation, but because of the ACLU, we were not successful in getting that fully adopted. They did extend another week or so of treatment, but that was about it. But this is an issue. We really want to help those who are in need, to get them back on their feet. We have to change the laws to ensure that they get that mental health treatment, to stabilize them. During a hearing that Helen and I had conducted, some of you participated in a few years ago at the Arboretum, we had parents who were coming and telling their sad stories about their children, how they had the ability to help them, but because they didn't want the help, they ended up being victims of crime, left on the street, and being having a severe problem. And one gentleman testified that he was under a freeway off for many years. He lived there. But he went and got medical treatment one day. What happened? It just happened to seek that treatment. And as a result of that, he was able to be stabilized and return to his profession. His profession was an engineer at JPL. I believe he was involved in the Mars probe. But he was able to get back his life by having that type of treatment available and utilizing that treatment to be stabilized and become a productive member of our society. We're not going to be able to help those individuals unless we have changes in the law. They need to have drug rehabilitation. They need to be involved in alcohol programs. They need to be involved in treatment for mental illness. One of the craziest proposals that's come out of Sacramento, and there are quite a few now, they need mental health treatment as well, is the proposal to take the inmates, releasing the inmates early from the state penitentiary and place them down here locally, and then we in turn will provide the mental health treatment and drug and alcohol rehab, et cetera, et cetera. But they forgot to send the money for that. Yeah. But they're going to send us the individuals. And now they have another proposal, which is to take those in the state penitentiary who are serving 3 years or less and sending them to a county jail to be housed. Not what are we supposed to do with those that are already there? Move them out? But what's interesting, it costs us about $28,000 a year to house an inmate in a county facility, and they're going to give us $11,500 to house that individual. Plus, they're going to make the local counties responsible for all the medical costs and any additional supervisorial oversight when they are released, which again makes no sense. But you've been involved in this longer than 50 years. You're celebrating your 50th anniversary. But these are some issues those are the type of debates and considerations ought to be made at the federal and the state level, using the input from the counties, the local levels across the state, to address a very important issue. We have 1 in 5 with some type of mental illness, about 1 million in Los Angeles County, so that we can address and correct and provide the help and the assistance for these individuals. Another area that is a great concern, the emancipation of foster youth at 18, expecting them to go out and be able to exist in this society without having any problems. We were able to get former President George Bush had signed legislation that was enacted, regulations that extended emancipation from 18 to 21, but it requires state approval, and our legislation to do that in California has still not been enacted. It's been introduced, but it's never been enacted into law. But again, an 18-year-old has no ability, without a support system in place, without a family, to have the resources for housing, resources for transportation, resources for education, and resources for the ability to communicate and have guidance and direction so that they can get on their feet and be a productive member of the society. No one in this room has been able to do it on their own. You've had family, you've had scout leaders, you've had Y leaders, Boys and Girls Club leaders, mentors, aunts, uncles, grandparents, godparents, a good teacher. Someone along the way has been there to help you. And yet we're turning out a large number of young people every day, 18 or older, who don't have that support system. And then we wonder why we have jails that are full and the coroner's office that has so many clients that they don't have room for them all. It's very simple. We need the resources in place, and these are the types of issues that we need to be focusing on. And again, developing more public-private partnerships to meet those needs. But hopefully through your leadership, your example, your dedication, we're going to meet that challenge and have those changes both at the state and federal level so that the next generation will have the needs and the services to be productive citizens and be able to be here and watch the next anniversaries that we have when Marv is going to be singing Glee.